I'll turn it over to our presenter today, Kathy. So the mic's yours.
All right. So first of all, thanks so much for letting me be a part of this project. I think it's awesome. I've been asked to talk about exercise prescription and programming adaptations, probably because I developed the Pals for Life workout. Next slide. Okay, so I know Pals for Life is primarily developed for breast cancer survivors, but the hope is that it's going to cover all different types of cancer eventually. I know Erin has done some work with that already. But to stick to the topic, first thing you need to know is it a cancer patient? I forgot to start my timer. I don't want to get in trouble. Is it a current cancer patient? If it's Pals for Life, then probably not. So we're looking at breast cancer survivors. What type of treatment did they have? Was it chemo, radiation, surgery, targeted therapy? They've got all kinds of new stuff coming out now. Next slide. So Erin showed these slides. I'm just gonna take them from her. So really you need to think about, how does cancer affect the body? Every single system that we have, from from your brain to your feet, everything is affected. And then we look at this slide where it says, how does cancer treatment affect the body? Again, nervous system, muscular system, cardiovascular system, respiratory system, every one of them. Because every system works together. I always like to think of it as a bicycle chain. If you have one link that's even a little bit kinked, that you're not going to be able to pedal the bicycle. The next slide, please. So how does exercise affect the body? Right, thankfully it affects all of these, because we try and get people to exercise because we keep telling them that it's going to help them. Primarily, I think if you look at emotional, psychological, and muscular, those I'll talk a little bit later. Those are the three continuums upon which I work. Physical, the muscular system in the physical part of it's probably the third system I look at. Next slide, please. Okay, so when we start talking about, if I was going to train all of you guys, or if all you other trainers on this call and PTs were going to train someone, you primarily look at 4 basic movements. You look at the upper body push, upper body pull, a hip hinge, which basically is a deadlift, and a knee hinge, which primarily is a squat, or more functionally a lunge. And then we have rotation and anti-rotation. So rotation is this, and anti-rotation is if I have a band out in front of me and it's being resisted by a doorknob or a person on that side, I'm holding it here and not letting it move. It's kind of like isometric training, but with the opportunity of movement, if that makes sense. Next slide. So we've got the 4 body, we know who we're training, right? We know their history. We have the 4 plus 1 movements. And then you want to figure out, and don't read ahead in this slide, just look at the top 4, right? No cheating, don't read the end of the book. I should have had that on the next slide, I guess. But what's the purpose of the exercise program? Is it to build strength? Is it to build endurance, flexibility, balance? Sure. But in my mind, and you probably are going to be like, what? That is, wait, I lost you. Hello?
We can still see you and hear you, Kathy.
Oh, I got nothing. So I'll just go based on memory. So it's actually to empower the patient, as opposed to, you're going to get, it's like the person who wants to come in and lose weight when they exercise. That's that's going to happen anyway. So you want to have them be able to focus on the exercises, and with this particular type of program, you're going to empower them. So I'm really not sure why I can't see my screen. But what's the next slide? You still hear me?
Yep, we can still hear you. Do you have a little box up in the one of
I
the
got
corners?
nothing. I had a gray screen. That was kind of scary. All right, is this the next slide?
Yes.
All right. So here's the three continuums that I was talking about: physical, cognitive, and emotional. So you could pick any you pick three people right now in your head. Pick somebody who is general population, apparently perfectly healthy. You've got somebody who was just diagnosed with cancer, and then you've got a third person who has just finished treatment and they've just been released by the physicians. They're cancer free, if you will, right? And think about where they are. So your first person, probably, I mean, our life right now is extremely stressful, but take all this craziness out. They're fairly, let's just say they're fairly stable cognitively and emotionally, right? You can hit them a little bit harder physically. So let's just say that their emotional and their cognitive are down at 10%. So they're only being stressed at about 10% out of 100. So they still have 90% of goodness on those two continuums. So let's just say we can hit them at 80% effort. And all of this is sort of, it's not literal, right? It's all just sort of a concept. You've got the person who was just diagnosed with cancer. Where are they on the cognitive and the emotional continuum? Pretty stressed out, right? Like 90. Let's just say emotionally they're at 90%. They're already taxed 90%. Cognitively, they're still working. They got to figure out all their treatment, et cetera, et cetera, et cetera. So they're stressed cognitively. So where can you need to bring them in physically, which you'll see when I show you a couple of the programs that I've wrote when I was at the cancer center. So physically, you have a little bit, their 100% is like 10%. So that's the first thing that you really always have to have in your mind. Not everybody can give 100%. Like you can't be, just divorced, writing a book, and still give 100% at your workout. Okay, next slide. All right, so this slide should have been, no, okay, this slide should have been up one, but I realized that after I sent it. With the guidelines, I always like to do two back exercises for every one front. 2 back, 1 chest, 2 tri, 1 bi. A glute max, a glute medius, a hamstring, 1 quad. Like in that concept, because we're always moving forward. So our hip flexors are always tight, our core is always weak. So we always want to start with the dorsal part of the body. Okay. 1 core movement, you want to do large muscle groups first. You want to do 1 core movement and then 1 rotation or anti-rotation movement. So that slide should have been up where I was talking about the 4 primary movements. Okay, go ahead and do the next slide, please. All right, we talked a lot last week about assessment, which was awesome. I never compare a patient to another patient or a person to another person. I look at the tests and I do a lot of the same tests that people will do, but I only ever compare the person to the person to the person to the person. So the person at the end of the 12 weeks, let's say, Erin, I would have tested them probably at 6 weeks in a perfect world, and then pre, right, when I bring them in and I'm doing their assessment. I like the 30-second chair stand compared to themselves, right? Because what makes a person feel better than if they couldn't do it in the beginning and then they can do 3? I mean, but where does that stand? If somebody says, how does that compare to a 52-year-old normal person? I go, well, 3, because you're a 52-year-old normal person. The get up and go, which I realized I should have put these on the references and I can send them out. If you Google get up and go test, it's right there. The person sits in a chair, you hit the timer, they stand up, they walk down and around a cone at a normal pace. It's not a race. It's at the normal gait, however that would be. They come back, sit down, and you see what the time was. Balance test. Can they stand on 2 feet? Can they stand on 1 foot, each foot? Can they stand with 1 foot slightly behind the other? And can they stand with 1 foot directly behind the other? Really simple. You can do all of these in conversation, right? Everybody, they're going to say, I can't do that. Okay, so just show me that you can. And then when you can, you're a rock star. Then you want to look at, I always look at, can they get up and down from the floor? If you can teach a person who can't get up and down from the floor, if you can teach them that, you are the rock star, because they will love you. I mean, it's like, okay, we're done here. There are certain things that you can get people to be able to do. Hold their grandchild in the chair and stand up, as opposed to just holding their grandchild while sitting in the chair. Are they familiar with strength training exercises? Yes or no? How do they seem to you? This is where you're sort of looking at emotionally and cognitively. Are they crying when they come to you? Are they excited? Do they bring their spouse? Do they bring their daughter or their child to show them how excited they are about this? Because you've already met them when they signed up or whatever. In a research study setting, they've signed an agreement that they're going to train with you. And then what equipment do you have to work with? I hate for the equipment to be the number one variable, but in effect it is. If I could give everyone one piece of equipment, it would be the TRX. It can do just about, I have a whole photo shoot of a guy doing exercises on the TRX, and it's amazing. You can do a little teeny itty bitty squat. You can do a full squat. You can do a standing back row. You can do a tabletop back row. So if you can develop a relationship with TRX or what's the other one? The red and black one. I can't remember what it's called. It's basically the same thing. It's just a different maker. And then I always say 2 things. I never want the exercise to be the stressor. And I always want you to feel better when you're finished than you did when you started. So what's the next slide? So here's where your expertise comes in. So based on the PAL study in PALs for Life, and Erin talked a little bit about it, we introduced a group, right? We already have all their information, and we have them do all their stretches. And then we have them do, I think, Erin, is it 2 exercises? I think it's like 2 exercises, and then we do their stretching at the end. And that's the first workout. And then the second day that they come, they do just that again. And then the next week, we add 2 more exercises in a very strict order. Upper body, lower body, upper body, lower body. Because even though you're only using your lower body for one exercise, your whole body is fatigued. So for instance, I always say that if a person is in treatment, so if you're working with someone who's currently in treatment, their body used to have one job. It used to be to be strong enough for them to be able to do whatever they wanted to do. Now the number 1 job is to fight cancer. And the second job is to be able to do whatever it is they do throughout the course of the day. So the body's jobs have changed. So that's the second workout. Then the third workout, we'd add 2 more exercises. The fourth workout, they do just that. The fifth workout, we add 2 exercises until we get, it might be like 5 weeks, 4 weeks, 3 to 4 weeks before they have the entire program. And in the PAL study, there were 2 types of people, 2 types of breast cancer survivors. Those who had lymphedema and those who were at risk. Not those who didn't, those who were at risk. And so you would every time they come in, have you had any increase in swelling? Have you had any onset of swelling? So that's why the research the strength of that research platform was that everything was completely dictated. And in the beginning, that's why we didn't use any exercise bands, because we couldn't tell how much the red band weighed, right? We knew that it was different than the other bands. So that's how we built that program. You want to use the equipment that you have, obviously, the abilities that they have. Probably the number one thing that I ever learned was that you can't change the person. You can only change the movement, right? So the next slide. All right, so I've just given you an example of how the PAL study was written. I have 2 sample exercise programs from the ENACT study, which is exercise and all chemotherapy, that I did at Penn State Hershey Cancer Institute. What's the next slide? So here's your exercise program for the PALS for Life, right? I don't know how much of that, Erin, you're giving out. I don't know how much of it you plan to give out. But those were the basic exercises, okay? You can see here, there's 2 back to 1 chest. We did shoulder scaption, which is this, standing up against the wall. What is that, 45 degrees? Right, this would be a lateral raise, and this would be a front raise. Leg extension, bicep curl. We did a very specific form of the back extension, and then a tricep press down. Okay, next slide. So this formatting is not perfect to be able to see it on this slide, but I'm going to explain it best I can. So in the ENACT study, we had 4 basic areas: balance, strength, flexibility, cardio, and rest. So I guess actually that's 5. So this particular person needed balance. Okay, so if a person doesn't need balance, we don't give them balance. They're going to get balance in other exercises, right? But this person specifically needed standing balance with support, and I suggested 3 sets of 10 seconds. So they're holding on to something while standing up, trying to stand on 1 foot, 3 sets of 10 on both. Fully supported. They answer yes, no. Again, I never want the exercise to be the stressor. This may be stressing you out, but they got it. The exercise was the standing band row, right? We used red. I'm pointing to this like you guys can see me, but anyway. We used red, and I had them doing 2 sets of 10, right? No 3rd set yet. So there was a reason I didn't give them 3 sets. I don't know what it was at this point, but, and then they were going to rate it for me, easy, medium, or hard. They were just going to circle one of those. Okay. Stretching, I had them do the single knee to chest, supine back stretch, which is where you lie on your back and you cross one leg over and you roll, right? And then I did active isolated stretching. If you're not familiar with that, I strongly suggest you look it up. It's AIS stretching. It's based on bypassing the Golgi tendon organ, and it teaches people how to breathe through stretching. So I had them do that on each leg for 5 seconds, and then I'm sorry, for 10 seconds, and breathing through it. And then their cardio was 2 times per day, 10 minutes each time. So they would, they tracked everything. Okay. And then go to the next slide. So this is a different person, different cancer, different person, no clue who it is. Walking in minutes. Okay. And then perhaps when they came in, they, you know, we lie about 2 things: how much we eat and how much we exercise, right? So perhaps this person thought that they were going to, you know, be feeling really good, and they wanted to do more exercise. So instead of me making it, okay, 5 days a week, then I expect you to do your cardio, I put 2 days in there, and then I said, and then you just write down whatever extra cardio that you do. Because then you haven't put them on the spot. Anything that they do is extra is a gift, right? So I had them doing TRX stepping, right? 0 weight. There's no weight in that. I wanted them to do 1 set, okay? they rated it easy, medium, or hard. The TRX row, I had them doing 3 sets of that. I'm pretty sure they're probably standing pretty much straight up, right? Bridges, so this person must have had some sort of a hip imbalance or sore hip, or maybe it was a brain cancer patient, whereas one side was weaker than the other. You see what I mean? So I had them do bridges, 3 sets. They rated everything, heel slides, clamshell right and left, and then the back stretch. And they put yes or no. Okay, so you can see by these 3 different workouts, they're all very different. They were all built on the same premise. Who is it? What kind of cancer do they have? How, fit's a terrible word to use in this, but where are they right now? How much can I push them? And what are the real goals to empower the patient? So the next is the references, I think. So basically what I did was I put the PAL study on here, and then the exercise and all chemotherapy. There is a poster out there that you guys can take a look at. And any information that I can send to you, I'm happy to. If you Google exercise and all chemotherapy Hershey, to my knowledge, there's no articles yet. I don't know that if there will be, but we did present a poster before I left. That's all I got.
Thank you, Kathy.